Here we go again. Here we go again. So I'm doing another updated video about the coronavirus because I'm trying to keep watch of it all. And it just seems to be getting more interesting every time I look around. There's something new with the coronavirus, and they have no idea. Pretty much, they literally have no idea. That's pretty much what I'm gathering from it all. I was watching the CDC, and I was taking notes during watching the CDC and making an announcement about what they thought, about what they were doing, about the things that are going to be updated. And I, as a nurse, was like, wait a minute, I have so many questions about this because it really doesn't make any sense right now. It 100% doesn't make any sense. I actually wrote notes from just the Homeland Security guy talking, which was just unreal when I seen him. Let me see. So me being the nurse that I am, I 100% will write notes about things that I see. And our friends at Homeland Security said they're going to take the approach of air, sea, and land, which is perfectly fine. Air, sea, and land is fine. But they kind of contradicted themselves. Hi, honey. I'm a little nervous about this virus. Hi, Gigabyte. Hi, Rose. How are you, sweetheart? I was just saying, I was watching the CDC presentation for the coronavirus, and it had me a little bit concerned about some of the things they were saying because it kind of sounds counterintuitive. The Homeland Security guys said they're going to attack it from air, sea, and land. But hi, Ken. Nice to see you again. The thing was, the guy was concerned. I was listening to Homeland Security, and he was kind of contradicting himself to me as someone who works in a profession. He was saying that people apparently, hi, Jammy. Apparently there's people that are asymptomatic and they're spreading the coronavirus. They have no symptoms and people are passing it around like nothing. My concern was there's going to be 7 airports, which to me, I was like, okay, 7 airports, that's fine. Where are these airports at and what is your idea? So it said anybody coming from China, they're going to divert all the planes. Yes, hold the phone, sis, because I pay attention. I listen. 7 airports. JFK, of all places, JFK, Chicago O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX. Yeah, this is crazy. Why would you have the busiest airports and you're going to drop a potential disease epidemic in your busiest airports? If you live in New York or you fly out of New York, hi, dumpster diving, Granny. If you live in New York, not only being in Jersey, so I don't live in North Jersey, so I live in South Jersey. So if I live in South Jersey, I can go to the Philadelphia airport, or if I want to drive, depending on where I want to go, I would go to JFK. I would go New York Airport. With that being said, why would you know that you can spread this virus a major city like New York? Hi, Clint's Crafts. You can spread this virus from a major city like New York with these are all huge population areas. Honolulu, LAX, really? How much people go through LAX? Seattle, Atlanta, these are major airports. So come apparently February 2nd. February 2nd, they're supposed to start this. I think it was 7 a.m. or 6 a.m. They had a time. Any flight that was coming from China is going to be sent automatically to these airports. Crazy. Super crazy. Then if you're coming from, they have customs agencies, what they're going to do is if you're coming from Wuhan, the actual epicenter, you have to be isolated. So they want you, wait for it, to isolate yourself. Do you know how many people are not going to isolate themselves. Let's just be honest. Imagine being, you might be sick. They don't have a definitive test right now, knowing that you're sick. And what are they going to do? They're going to count on you to stay home. What? No. Those airports are super accessible, but the problem is you have so many people going through those airports. How are you going to set up a system with enough people to scan? It sounds like BS. It sounds like BS. Then they have the people from the Wuhan province. They get isolated. Like isolated. What about the other countries that have third world healthcare? And I don't mean that in a disrespectful way. I mean like in a way like that don't have a really great infrastructure for certain types of illnesses, like who like the Ivory Coast and parts of Africa that don't have a wonderfully structured healthcare system. And you're going to still take all these flights from these people, but you're going to try to monitor them, but then you're going to want them to self isolate. That sounds so counterintuitive to what they do. And then they're honestly talking like the things that they don't know. They don't know 100%. Yeah, that's crazy. That's crazy. There's so much stuff out there. Asymptomatic transmission, meaning you could be 100. Hey, Philly Road Tech. Yeah, you could be contagious and walking around and not know it. Like you could be 100% contagious and not know it, which is crazy. But you also could be somewhere, anywhere, like the Philippines. There's cases, France, British, like there's cases everybody. There's cases all over the place. Now they're talking, they don't even know the incubation period. So they don't know how long it's in there, how long it lasts, how long it does. They don't know nothing, essentially what they pretty much said. They don't know how fast it transmits from one person to another. There is a test, and as after watching the CDC and then the World Health Organization yesterday, it doesn't seem they have a test that they're really confident in, honestly. And they don't have enough tests to go around. And they also don't know how severe the disease is, which is crazy. Like to me, you have all these people, like what they count when they try to track the severity of a disease is like how many people catch it. Hi, Mika. You know, girlfriend, I was on, I'll go view your videos, Tamika, darling. Rose, I'm terrified and I'm a nurse. I'm not terrified yet, but I have a super heightened sense of awareness that the more information that comes out, like they don't know the severity. Usually what they do when they figure out a disease, like say they figure out like how lethal a disease is, SARS was super lethal, but this is more contagious than SARS. So what happens is these people are like super spreaders because they don't know that they have it. And they're going all over. Like you have a Super Bowl in Miami, and then they were trying to test these kids and test them negative. And I mean, this is craziness. And then they say, oh, well, there's a low risk to the American public. Hi, Meg. But if there's such a low risk to the American public, why would you be doing all these measures to scan all these people at airports, isolate people from China into their own isolation areas, and then you're leaving it up to local health departments to monitor these people? That's what you're leaving it up to. You're leaving it up to your local city health department to monitor these people and make sure they stay in the house and don't go grocery shopping or go to the mall. Are you kidding me? That's the craziest thing I've ever heard. Like the process, honestly, like I was listening to him talk, like with any kind of disease, you identify the disease, you diagnose it. If somebody has something catchy, yeah, that's who can show that. You treat the person, and then the most important thing when you have a disease like this, hi Las Vegas thrifts, the most important thing when you have a disease like this is you contact trace, which means you have to, okay, so say I went to work, I was around 10 coworkers, 40 patients, and then all the people they were around. Do you know what I mean? So contact trace is the hardest thing. And right now, like It's like, who left the gate open and who's going to monitor all this? Like, it's amazing. Like some of the stuff he was saying. Las Vegas tourists, listen to these seven airports: JFK, Chicago O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX. This is where anybody that was in China, anywhere near that Wuhan province, is going to be dropped off starting February 2nd. So, my friends, is like, if you drop them off there, what happens from today and tomorrow? Like, you're still letting all these people in. Like, it's crazy. Like, you have cases popping up in Japan. Hi, trans daddy of reborns. Hi, honey. Like, you see all this, and as a nurse, I'm like, this ain't good. Like, why are you know more than what you're telling the public, because you don't want someone to panic. You don't want medical staff to panic. One case was actually caught by a prudent doctor. That's what they said. A prudent doctor. The case was caught by somebody who realized there was a disease out there and was like, have you been to China in the last 30 days? And I asked them the question. They said yes, and they had the symptoms, and now they have to be isolated. Like, we have a great health system in the United States comparatively to other countries. Yes, it's expensive. We have, that's where I'm going, Mig. That's the problem. The economic burden to China is at, I think they said, over $1 billion. I don't know. I can't say that it's a bioweapon, because there's so many things. I could tell you that the people in Australia recreated the virus in a lab. That I can tell you, which is crazy. They recreated the virus, and China had sequenced the DNA in a matter of, I think it was like a couple weeks, maybe 2 weeks. So, they have a history with these diseases. And don't get me wrong, I love everybody. 100%. I love everybody. I don't care if you're green, brown, purple spots. Might be awkward, but I love everybody. So the sad thing is that they're saying that the risk is low. You wouldn't centralize this kind of stuff and do all this if you really thought the risk was low. And that's just my take on it. Like, you really wouldn't. 7 specific airports that are highly populated, that you really think that why would you not choose airports that are a little smaller, that maybe could accommodate whatever's coming over? Because you're putting them in a central population. So if they are infected, there's 1,000 people in the airport. How do you contact trace 1,000 people who have now had contact with 3 people each, who have now had contact? It'll exponentially grow. And I think, although they thought this was the master plan, I don't think this is the correct plan. I think when you seen this virus was there, whether China knew about it in November or December, I think at that point, everybody's radar should have been up. Like, I really think so. I think everybody's radar should be up. I think, yes, you should watch the video with the mask. Are they going to protect you 100%? Nope. But guess what? Excuse me. They might protect you enough, just enough. So, like, honestly, like I told my kids and some of my close family, like, listen, I understand there's a coronavirus. Hi, Oz TV. It's really important to protect yourself. Yeah, like, seriously. How are you going to come out with it? Like, the coronavirus has been out. I've heard one statement from wherever, and now from the CDC. Like, hello, you should have been on top of this. Like, you have a expensive yet great medical community that was willing to really go hard on this and try to figure this out, put things in place. You have hospitals putting things in place, trying to mimic the CDC's recommendations, but they're coming up with better ways. They're asking the questions even before, they came out with these guidelines today about ask, have they been in a country, or ask if they've been here, or ask if they've been there. Like, no, hospitals, individual hospitals are coming up with places and trying to detect this, because they know how the risk is. There's so many unknowns. And yes, you have a flu virus. Like, and everybody, someone asked me, like, well, okay, we have the flu virus. Why don't people panic over the flu? Well, people don't panic over the flu is because we all have we have a lot of knowledge about the flu. We have some vaccines for the flu. We know how the flu works. We know how the disease course works. With this, we have no idea. And yes, people get a lot of hospitalized for the flu. They get a lot. There's people that die because of the flu. Understood. Affects a lot of the older people and the young people. Understood. Yeah, see, there's the thing. They're sending them to 7 airports in the United States, which are the biggest airports that I can think of: JFK, Chicago O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX. So because oh, you're sweet. I love Japanese. She's my sister from another mister. Um, it's pretty scary for me that not only being a nurse, but being a mom, and then you're out in the community and you go do other things, and then I personally, if I was infected or anybody else, there's cases where you don't even know you're infected. You might not have symptoms. Meanwhile, I'm home hanging out with my kids, or I go bowling, I go to the movies and I touch everything, and I go to the bathroom and I do this. Like, meanwhile, I'm becoming a super spreader. Like, that's not, who we really need to be mindful of this. Like, yeah, I honestly feel like these steps that they're taking now should have happened several weeks ago. They shouldn't have happened now. I think the US is actually super late on these things. And I'm not sure about them JFK, them 7 big airports. And especially that you're asymptomatic. You're bringing everybody in on these international flights, and then you're going to scan their temp. They're asymptomatic, and they're going to be on their way. Well, okay, so they're going to be on their way, but what if they don't have any symptoms? So you're scanning them looking for a flight. I mean, you're looking. Sorry, I see the flight thing. You're looking for you're looking for a temperature, and these people, they don't have any symptoms. So meanwhile, they're just spreading the disease. They're touching the cups at the airport. They're touching the rail. They're touching the ticket booth. They're touching this. Somebody's touching their bag. They're touching their bag. They're getting in taxis. Like, they're getting in the Uber. The Uber drivers taking everybody everywhere. Like, this can get out of control. The stuff that they should have done. This is what they should have done weeks ago when they first heard about it. We are 3 weeks behind on what needs to be done. Now, understand, yes, 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 there are some things that we can do, not as nurses, but as the general public. First and foremost, wash your hands. Oh my God. The 5 blocks where I live, we had our first case, now 9, and isolated on the Gold Coast. They came in on January. Yeah. Do you live on like Christmas Island, Oz? Because I was hearing, again, I try to watch everything, read everything. I was hearing how they were taking people from China and sending them to Christmas Island. What scares me the most is not as much as we all know our radars are up with people from China and the Wuhan province, but people aren't really paying attention to the people that are infected in Japan. It's now in the Philippines. There's a high Filipino population where I live, and they go back and forth for vacation a couple weeks ago, and they all go for holidays and this, that. 600 are going to Christmas Island. Like, that's the wrong kind of isolation. And so you're taking infected people and quarantine them on an island. Hi, Pure Mom Life. Hi, Bestie. Listen, hold on. You're taking them and put them on an island, and then, hello, what do you think is going to happen? How are you going to quarantine them people against the population that's there? And do you have enough medical structure and stuff in place to take care of those people? Yeah, love, Pure Mom, Bestie, darling. Airports: JFK, Chicago O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX. Starting the second, all flights from China, and especially the Wuhan province, will be diverted to those 7 airports. I don't want to fly. I don't like flying anyway. India has it. Wait, I'm gonna get to that. China, Japan, they have all these cases. Don't count your horses yet, babe. Don't count your horses yet, because there's cases that are investigated in hospitals near you and near us. We'll just say that. Yes, there are. There are, and it's not the ones that are on the news. Yes, there are. Please believe me. Yes, there are. I work in a healthcare system. Yes, there are. And they're under investigation. There's plenty. There's like about 4 or 5 patients quarantined. Yes, there are. Don't underestimate what you hear on the news, because they're full of it. They find out 2 days after everybody else finds out. Wow, that's crazy, Ken. That is crazy. Yeah, I'm ready to move into like the forest too. But don't worry, like they got like Atlanta, Honolulu. There's no cases in Honolulu. Why would you even drop anybody off there? Like there's nothing. Why? Because they're close to the Japan side. Like I don't understand. Now of my last looking, the case is there are cases in Africa, which to me is scary. And sorry, I'm about to look something up. And what I seen that scared me the most was I'm gonna show you in a minute. The one good thing India did. Well, here, let me just start by this. Most of our where they at? Where's my little mask? Most of these little masks, these aren't made in America, kids. No, they're made in China. They're made overseas. So guess what? When they can't export them no more, you better have yours. Or even N95s. They're not made here. Nothing is made here anymore. And that's the sad part. We really need to make our own stuff. So yesterday, I was looking online and I seen this thing that India's first confirmed case of coronavirus. That's scary to me. India has an enormous population of people, and is a lot of poverty, and there is a lot of there's places that have great medical care, and then there's some that do not have medical care because you get a yeah you can there's a lot of places that have it 100%, a lot of places that have it. No, there's no treatment. The only, you know what the treatment is? I'm going to tell you what the treatment is. Isolate you so you don't infect anybody else. They give you fluids because your lungs, what happened is your body is you have all this runny nose and all this. And these coronavirus cells work like that little ball suction cup thing. And they go through and attack the cells in your respiratory tract, meaning they attach to your lungs. You have these little grape-like clusters in your lungs that exchange air and they fill up with fluid, but not like the normal pneumonia where it's either at the left on the bottom or the right on the bottom or like right up top or, it's different areas. They fill all the way up with fluid, meaning you can't exchange oxygen no matter how hard you breathe. So you have to get put on a ventilator. With that being said, now you have like China's a huge population. India is a huge population of people, and a lot of them kind of live in some kind of poverty. So then I was going through and I'm like, okay, that's not good. And then I was reading, I was like, okay, wait. Then I'm reading and I'm like, the Indian government, right, advises homeopathy for coronavirus prevention. What? No, 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 no. No, no. It says the Indian Ministry of Health confirmed on January 29th a student studying at Wuhan University who returned to Kerala has tested positive for the virus and is in isolation in the hospital. Here's the kicker. Around 800 people are also under observation, with 10 already in hospitals. So where are the other 790 people at that in India under observation? It says the government issued an advisory based on the Indian traditional medicine practices to be preventative steps to ward off deadly infection. Listen, y'all, I love y'all. I love every one of y'all. I don't care what country you from. I don't care. I'm sorry. I'm not sure if ginger beets and some dal is going to help this right now. I'm 100% like, I think people need to be taking not a homeopathic. I think they need to be taking a severe consequential effort into making sure this doesn't spread. If you have one reported case in India, but then it clearly says that their own government said, like, wait, what? That 800 people are under observation and 10 are in the hospital. That means 790 people are in India with or without symptoms, and they could be contaminating everybody. Like, I don't understand. Like, and then they're talking about, using homeopathy to or light cures or some kind of solution. And I'm like, sweet baby of the Jesus, like we really need to get this together. And it's sad because I'm just looking through. Because there's like a lot of false information about different countries. I don't live in India, but I've seen a lot of stuff about. I actually work for a bunch of. Hi, Alice. I worked for Indian people. They're really sweet, wonderful people. Very nice, very kind. Love you, feed you, take care of you. Especially when you're sick, they just want to help you. That's just who they are as a people. That's who their culture is. Even Chinese people, they also want to give you soup. Like American people, they just different places, different cultural norms, different stuff. Um, I can tell you that it's getting scary for me because when the United States sits there and puts all these travel bans in place, not necessarily a travel ban. Let me reiterate here. It's not a travel ban. It's travel stupidity to isolate these people in these airports where you have thousands of people going through every single day. Thousands of people. So if I'm asymptomatic and there's thousands of people, I have the potential to interact with 1,000 people at minimum. Hi, Chopton. So imagine I'm interacting with these people and I've just contaminated the whole airport. Are you kidding? Or I actually shake the hand of the pilot or the flight attendant or give the guy my ticket. And I was just like, oh, I'm so tired. Thanks for my ticket. Touch him innocently. And then he's like, oh, I'm tired, and wipes his face, inhales the coronavirus. That little factory starts going. And then what happens? Then all of a sudden, here we go again. We start touching each other, and he's touching everybody because he handed them tickets. And boom, boom, boom. You have one person that affects everybody that goes through his line. And then you have to keep tracing that back. Like it's an arduous task for all these contact traces. But the sad thing is that it's not going to get better. And China said that they expected that the virus was going to burn out in 7 to 10 days. I think you're wrong. It's not going to burn out in 7 to 10 days. I've not seen that kind of miracle. You know what's going to happen? It's going to ramp up in 7 to 10 days. You're going to have, I give it a stick. You're going to have, it is scary because it's even, no, it's okay. I can always catch you up. It's scary for me being a nurse. And it's also scary for me. Like it is terrifying. It's more terrifying for me as a nurse than it would be, I think, for the general population. But what makes it scary for me is because, oh, sorry, I'm moving the laptop. What makes it scary for me is because I'm around people. They breathe all day, they cough all day. You put neb treatments on them. You have all this interaction with families, and like you don't know where they come from. Like they just get from the hospital, and now you're like your antennas are up when somebody is coughing, sneezing, respiratory difficulties. And then if you send somebody out to the hospital, your concern, like I work 2 different types of facilities. My concern is if I send somebody to the hospital, who's at the hospital that may contaminate my patient and I could bring that back to my facility. It's pretty scary for me. And the fact that I don't think it'll become like the flu blender master. I really don't. I think it's going to be just like SARS and MERS. I think what's scary about this virus is the fact that it's on all its unknowns. And China said that the virus is going to burn out in 7 to 10 days. And this was like, I don't know, 4 days ago. I can guarantee you I'm right. China's going to report. I think the death toll is going to rise because the people in Wuhan, you have brought corona in your home. Yeah, that's crazy. I really think that like there's videos of the people shouting to each other, giving each other moral support. But what about some of the elderly people and the people that are there that may be infected that can't reach out and talk to somebody and say, hey, I'm sick, or maybe already deceased in their living quarters? It's so sad to say, but it's the truth. It's very sad. Like you want to go check on your elderlies when something like this, like elderly people in your neighborhood, when something like this happens, and because you're fearful on top of going to see them, you know? And I think the whole situation is sad. But I can almost guarantee there's 100% going to be more, definitely more deaths. And I think that the contagious total is going to be in the next 7 days. I think they're probably going to report like 15,000 cases total. Because I think I'm going to look it up. I'll tell you what it was. Because I think it was at the coronavirus total was at like 9,000. I'm gonna look it up and I'll tell you. Let's see. I'm gonna find out what the total is. I'm gonna look it up. So it says 258 people are dead and 10,000 cases have been confirmed in mainland China. It says there's a travel ban, but there's really not. Yeah, it says there 8:14 p.m. at January 31st. I'm on CNN's website. It says, I don't think super gonorrhea is more terrifying. I think if you realize what the disease was, it's very easy to stop gonorrhea. It's not as easy to. I think honestly, Alzheimer's dementia is more terrifying to me than a coronavirus. Imagine forgetting who you are and you don't know your family. That's pretty terrifying to me. But they were saying an estimated. This is crazy. An estimated 75,000 people in Wuhan, China, could be infected with the coronavirus as of January 25th. Researchers in Hong Kong said. Gabriel Long, one of the authors of the study published Friday in the medical journal, said the estimates could be much higher than the number of confirmed cases because not everyone who is infected would require or seek medical attention. That's the dangerous part. People are not, I'm in the United States, people are not actually being mindful about stuff. They're not being mindful of it. That originally thought this was going to go higher. It's going to go a lot higher. I think that, well, they're saying 70,000. I think right now that the actual case number is like about 10,000 in that neighborhood. I think it's going to be at least, just in China, they're probably going to have at least 50, 60,000 cases. And then the worldwide numbers, some of them are going to spread. But the only thing that right now is that's actually working is for people. Yeah, it doesn't. It makes it worse. And right now, the only thing that's going to help, the best thing that helped was actually the guy that got it in California and realized he traveled to China, heard about the news, and then literally isolated himself and was like, hey, I have these symptoms. Like, that was the smartest thing he could do, because if he went out about his daily life, he would have infected many, many people, who then would have infected many, many people, because California is a populated state. That's what would have happened. But because he was prudent and didn't do that, same thing, I think something happened similar in Canada. They kind of warned that they call, I guess, their GP, the same thing, like, hey, their general practitioner, like, hey, I'm having these symptoms. I was in China. Clear out the office. I'm coming. And they're like, no, divert to a hospital. We'll get you there. So that's just what's going on. But if it wasn't for prudent people and being responsible, that's part of the issue here. There's not a lot of responsibility. And not everybody is this responsible and prudent with it. And I think it's really going to get worse. The terrifying thing for me is, like, you're dropping these people off at these main city airports. Like, I was trying to understand the rationale behind it. Like, maybe you can scan more people, but you're going to also, if somebody is exposed, you're going to expose a lot more people. More people go through these airports. Lots more people. Why would you not send them to an airport where you can actually take flights? You can take 5 flights, 6 flights, 10 flights, whatever it is, of people. There's not that much travel from China or to China right now. So take them and have a specific airport that is a quarantined airport. Be like, hey, okay, so we have this field and they can accommodate Boeing. So listen, the only planes you can use right now are Boeing 737s that can fit in this airport, and that's it. That's all you do. You specifically fly into this place, this town, this, and you're automatically scanned like a private airport. But if they would have done any of this earlier, I think we wouldn't have any of the cases we had. And I think they're seriously late behind it. And I think people need to be honest, and they need to prepare for stuff like this. They need 100% to prepare for stuff like this, because right now there's a lot that they don't know. They know the flu kills people. They know this kills people, but they don't even know how many people are infected, how many people are truly dead. They don't know a lot. All they know is that there's a virus out there and there's a lot of third world countries infected. Like Vietnam is infected. Again, high population, some of the world's poorest people. Africa, some of the world's most dense population, some of the world's poorest population. Like these are very scary things. And that you have people that are able to fly. Like you may restrict China, but what about the other countries that the people from China have been to and now are contaminating? Like you really need to fix that. It's just not good. I just don't think it's a prudent practice right now. I think you should have restricted flights or did this whole airport thing weeks ago. You would have caught many people. Now you don't know who's out there spreading what. And it's like the flu season. Come March and April, flu season is going to go down, but now you're going to have all these people with colds and flus that look similar. The symptoms are almost similar. So I'm like, oh, I got a cold. I'm fine. Oh, I got a flu. I'm fine. I got this. I'm fine. Come to find out, no, you're not. You got this virus because you went out to grocery shop or you went here, you went there. So West Japanese, you got to be careful, sis. Real talk. Real talk. Because there's a lot of cases in your neck of the woods. And the honesty about reporting has not been hi Kim. The honesty with reporting has not really been there. Because with the SARS epidemic, apparently there was a doctor who was working on a case. It's all good. There was a doctor that was working at a Chinese hospital, and then he realized there was a disease out there. Nobody reported. He went to a wedding in another place, and then he touched the elevator and contaminated people, and then so forth. And then this guy flew here, and then it just went on and on and on. And then all of a sudden, like you had SARS everywhere. Like so, this is going to be. I think there's going to be more cases. I think there's already more cases of this than SARS, and it's more contagious. I'm about to figure it out. Let me see. Yeah, right here it says Wuhan coronavirus infection surpassed SARS. That's scary. SARS was all over the place. Like these are like they need to understand this is a pandemic. It's everywhere, and it's not going to get better. Yeah, like they announced like over 1,000 cases. Yeah, you have 3 in Ontario, and they're investigating more. There's a bunch in the United States they're investigating. India has cases, and they're encouraging homeopathic medicine, which I almost smacked myself in the face for. Which I understand, like the cultural thing, but you're gonna need a lot more than that. They need a lot of supportive therapy. Like you're gonna need nebs, you're gonna need oxygen, because what happens when your lungs fill up with all that fluid? That's it. It's ball game. You're not gonna be able to breathe. You're gonna need like almost like a ventilator. You're gonna need a ventilator to force air into your lungs, and that's what a lot of old people don't have that immune support. They don't have that function, so it's all good. They don't have that. Kim, like I was telling everybody else earlier, that our friends in the United States and the CDC decided they were going to pick 7 specific airports to screen people from: JFK, Chicago O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX. So some of the busiest airports. Like I heard that and I was like, okay, I got to hear that again because this can't be right. It's right. And the cases are growing. The only, I don't want to say good thing about this virus. The only thing about this virus right now is that countries like Canada, United States, Australia, they have people that are infected, but you have better health systems. You have more forthcoming governments that are actually watching these people. They're not leaving it up to whomever. Like they're literally scientists are involved in these few cases to watch how this disease progresses, so they know. That's all right, Becky. Yeah. but they are there's a lot more that they don't know. I said, and it's just so it's concerning that there's all these cases out there, and there's science and everything involved in these cases, but the other cases that we have, um like they're not paying attention to. Like, my thing is, like, you have scientists involved, so a lot of the information that we're gathering right now is coming from the scientists in Australia, British, France, um, Canada, US, so because they're actually monitoring these people to see their symptoms, how's the course of the disease. They're trying to figure this out to come up with and sharing information. Right now, you have people in China, because of the population and how big it is, like, they did the right thing by isolating all these people. That was their first step to really, they were like, listen, we got to shut it down because you just brought a good one. Remember, not en masse. Eventually, you got to throw them out. Just saying. They get moisture. They don't work anymore. They just let everything sit on your face and doesn't filter. But that's what happened. That was the one good thing they did, was they quarantined that population, which cost them a lot of money. But I don't think they did it fast enough. I think they were trying to push it off because apparently there was a case in November and they were hoping that they wouldn't spread. And then the Chinese New Year came and it just became a big, giant mess. Me personally, as a nurse, I'm making it a point. I'm not sure the severity because there's a lot of dishonest reporting. There's a lot of, right now, what they're reporting and how many cases they have is making it look like how severe the disease is low. But if you're under-reporting the amount of deaths and you're over-reporting, like, and you're telling the amount of cases, no, that's fine. Any mask is good. Any is better than none. As long as you put it on the right way. Put it on the right way. I don't know if it looks like my yellow one, but make sure that bad boy is tight to your nose. There's no gaps here. A lot of the face masks have gaps on the side because they're universal. So you'll have gaps here, but at least you'll have some protection. But me personally, like, yes, I always have masks anyway. That's just me. I think everybody, make sure you have water. Make sure you have like a few extra supplies around. Like, go to the store, you buy, it's not a full blown in the United States. And I think that because of the efforts of the CDC, and let me correct myself. I think because of the efforts of the actual doctors and nurses and all those people, that it won't get to be that bad. I think so. I think it'll still be severe. I think we're going to get a lot more cases in the United States. But I think that because of the nurses and the doctors, it has silicone around it. Is it N95? I think because of the efforts of the nurses and the doctors, I think it's going to be less than it is because you're going to have these health professionals trying to identify it and immediately isolating people. They're 100% going to do it. I can't count on a single health department. I can't say, oh, this great Trump. I can't, because Trump's not going to be in there with a mask and a full bodysuit. Like, I don't see that happening. But I do think that this is going to be a big problem moving forward when it comes to these kind of outbreaks. So I think everybody should be more prudent with a lot of things, more prudent with your hand washing, more prudent with making sure that if there's an emergency, you have some kind of plan together, you have some kind of kit together, you have some kind of, and if you don't know about those things, I think you really need to start looking into, what do I need to do in the event there is a situation like this? Because if this isn't the super virus of the generation, because there's going to be one, and you can't keep having the same market standards. Like, supposedly they're like the virus of the century. Birdbeak had a question. What do you think about the possibility that there were people who weren't showing symptoms that escaped before the travel bans? It's not even essentially a travel ban. It's just a BS. 100%. They didn't escape. They just kept going. Absolutely. 100%. 100%. They did. Because there's people that aren't, even the CDC right now doesn't know, like, the incubation period, the speed of transmission, how severe the disease is. They don't know how severe the disease is because, respectfully, I think they think China is underreporting the deaths not necessarily. Hyper because empire, not necessarily the amount of cases. I think they're underreport. They might be underreporting everything to make it look like not as severe as it is, and they're doing these grandiose efforts. But I really think that there are people that they said have come asymptomatic transmission. So how do you know um, who has it and who doesn't? And right now, you don't know. You have no idea. Like you have not a single clue on who has this, who doesn't, who can't. Like as when you go to like a hospital setting, the first thing that they ask you is, have you traveled outside of the country? Not even to China. Have you traveled outside of the country in the last 30 days? It wasn't even to China. It's outside of the country. And some of the hospital systems are coming up with those steps and measures. If for anybody that has those cough flu symptoms outside of the country, have you had these things? Where have you been? And that's what they're doing. What number? I can't tell you. I have no idea. Young people fly in and out a lot. A lot of people use the airways. You have no idea. You have no idea how many. It could be 5 people. It could be 500. You have no idea how many people that necessarily they didn't escape, but they're asymptomatic. And even though they're asymptomatic, they're shedding this virus with touch. So it's so important for people to make sure they wash their hands, like basic hygiene. Wash your hands after you go to the bathroom, before you eat. All these things. If you get any of these symptoms, like call your doctor. Be like, hey doc, I was here, I was there, I was wherever. I really need to keep an eye. You need to keep an eye on it. It's very, very, very important that everybody remains diligent, not only in like especially in school system and hospitals, but in school systems, hospitals, churches, all these places that have the gathering of people. Time to move to the moon. You know what? At this point, I wouldn't move to the moon, but I think people need to be more diligent. They need to wash their hands. They need to practice hygiene. I think they need to be careful if they're coughing or sneezing. And the same thing that goes, yeah, clean off your shopping cart handles. But here's the thing: when people do that, they clean it off. They automatically put their hands on the wet thing and then just push it. They don't even let it dry. So you just put that sanitizer stuff on the cart. So you just made a nice wet surface for the bacteria to stick to you. So people don't let the surface dry. So people can wipe their cart, like the handle to their carts, and then that's fine. But here's the thing: they don't let it dry. They just keep it going. And money is the dirtiest thing, but that's beside the point. Like they don't let that dry. They don't let that dry at all. So that's what happens, and it's very easy to get contaminated from carts, this bags. It's just so at this point tracking down all these people and then sending them to major airports to me is like I didn't see the rationale. I didn't hear anything about the rationale. I was trying to figure out what was the purpose of them sending them to these airports because they think I guess maybe they're going to have better screening methods. They're going to have more. No, we're not all going to die. We just have to be all mindful. Oh, sorry, I'm sliding. I'm in my bat cave at home. No, I just think we need to be all mindful about the stuff that we do. And when you're sick, stay home. And I know it's a big cultural thing for us. Your grandpa uses sanitizer every time he gets in the car, touches money. No, he's not crazy. Make sure the hand sanitizer dries. Rub your hands to the hand sanitizer dries. But no, he's not crazy. A lot of people are the same way. They do it. Door handles. Listen, I was so nervous at the local convenience store. You know how they have the handle across the door so you can push the door open? I was touching the glass. I never touched the glass because I got to clean the glass. Wearing gloves everywhere will not do anything. No, won't help. Maybe a little, but it's not really going to keep it. If you're going to get the virus, you're going to get the virus. Because if you wear gloves and then you touch your face, it doesn't count. Like people aren't prudent in that way. And that's what happens. It's just really sad. I know, nice try. But I think you should just wash your hands frequently before you eat. Don't touch your face. Like I come in the house, shoes off, all the stuff off, shower, and then I don't touch anything. I clean everything off. Like, and you have to clean everything off. Because whatever germs are there, you don't want to bring them home with you. Like I got kids. So we don't want to do that. But at the same time, you really have to be mindful about what's going on around you. And the scary thing is the third world countries that have it. And I think that's why the World Health Organization was thinking along the lines of not the job that China's doing. They were thinking along the lines that this is popping up in countries that don't have a great medical support system. And that's a problem. It's a big problem because it's going to spread. It's in Africa, it's going to spread. It's in India, it's going to spread. There's a lot of people in a concentrated small area, and there's a lot of poverty. And I'm not saying everybody there is poor. Please don't take that impersonation. Can you say homeschooling? Yeah, your duck should be okay. But you have to just be mindful, 100% be mindful make sure that you clean your hands, like you do all these things. But it's really crazy that they're going to start implementing this on February 2nd. Um, and I have a little idea about this because, and it's going to sound crazy, and I'm not usually the conspiracy person. You're going to let everybody fly in for Super Bowl weekend, and then you're going to restrict travel. Nobody is flying in a Super Bowl weekend on Sunday. Rarely. Everybody's flying in tonight and tomorrow. So you're having Miami, not even one of the places where they're checking people. You're having all these people fly into Miami. How many people can fit in the Superdome in Miami? Like 50, 60,000 people can fit in there, and are going to be, if not more, going to be at the event. And we're going to start it February 2nd. Don't worry about Super Bowl. Y'all have your event. If you get sick, don't worry. We're still going to have it. And I'm thinking, why would they pick why wouldn't you say starting now? Why don't you pick February 2nd? Like, that's foolish. Start now. Matter of fact, you should have started 2 weeks ago. To me, it's just the ideology of it all is crazy. I don't understand. Like, that's the only thing I can think of. You're not going to let anybody rain on your parade and mess up your money. But there's a lot of things that are scary with it. It's very scary. There's a lot of things. The fact that the United States really don't make masks and you have to outsource them from China. Well, it looks like China's going to need theirs. Where are you going to get yours from? Like, most hospital systems, they have companies they order from, but the mask on the box doesn't say made in Minnesota. They're made in China. So we need to start respectfully making something here to protect us. Like, we really have to think about that. We can't just make we can't just make vaccines. It's just not going to cut it. We have to learn how to make our own stuff again and make our own factories and be able to help ourselves at times. And I think that's part of the problem here. And I think the wet markets in China are a big issue. 100% big issue, wet markets in China. You have people selling meat and stuff, and oh my gosh, it got real bright. You have people selling meats and stuff in China in these wet markets because they're exotic. And then you have a snake sitting on the top of a beaver who's sitting on top of puppy cages. And then meanwhile, one of those animals could have been bitten by a bat, a rat. And then that contaminates the next animal, which makes it easier to jump to. You pet the little doggy. Boom, done. That's it. Goodbye. You have it. Your operations in China are coming to the USA because of the coronavirus. There's a lot of people. There's a lot of people that are, which is crazy because they're sending them to the big airports. Like, I was floored when I heard that. I had to rewind the video. Like, I was like, what? Why would you do that? You're just making it worse for people. I think it's pretty bad. I think everybody, not to be a Debbie Downer, not to be like the world is ending, because that's not my forte. I want to see my grandkids have a beautiful world. I just think we need to 100% be prepared for some of the stuff that's going on, and it's really not good. Like, I think everybody should, you don't have to be a doomsday prepper, but I really think that people need to be more mindful of making sure that they have, if we had to be quarantined in our house for 2 weeks, what we do, make sure you have your nachos or, like, seriously, like, you're going to go stir crazy, have something to do, have some games for your kids that aren't like regular games, have some playing cards. Think about the things that if you had to stay in your house, that's my homework assignment to everybody. If you had to stay in your house for 2 whole weeks to protect yourself and your family, what would you do to not go stir crazy in your house? Because I think we all got away with that because we all have all these electrical devices. So my question is, and my homework to you guys is, what would you do for 2 weeks in your house? Uno cards, regular cards, puzzles, puzzle books. These are all things that you should think about to entertain yourself. You don't have electronics or you don't have access to going to the movies or so I think we need to get back to some of the basics that we had before. Yes, technology is great, but I think I want everyone to do some homework to try to think, okay? What would I do if I was stuck here? What would I do if I was stuck in the house? What would I do? You have so many toys? All right, well, what are you going to do? Clean up the toys? You're going to be playing with the little poppy thing. You know, the little lawnmower pop thing? That pop, 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 pop. No, you go out the window by week 3. I mean, by day 3. But think about some of the things that you would do to entertain yourself or entertain your kids. Right. That's what you definitely need to think of. You need to think, but also think outside of the technology world. Like, think, okay, do we play cards? What can we do as a family to keep ourselves entertained? If we got stuck. Yes, there's Netflix and Amazon and all that. What else would you do? You have to think about that. And yeah, exactly. Like I always living in Jersey, um, we've had a few. I learned back in like 2007, 2008, and my kids were still little. I was already a nurse. Like it started snowing, and let me tell you, it started snowing to where I was working 7 to 7. I had to get up, and I got up in the morning, and I was trying to sleep a little extra, and I was like, okay, because they knew it was going to snow, so they were trying to, stagger everybody's shift. So they wanted me to come in at night, and I was like, all right, I'm going to sleep a little while, and then I'll come in, whatever the case is, fine. So I slept, and they were chopping up shifts, and I got up at like 10 o'clock in the morning, and it was snowing. And by 12 o'clock, there was probably already 6 inches of snow outside. After that, I was like, okay, I'm going to go to work now and not wait for like 4 more hours because I'm going to get stuck in all this. I had a car at the time and not a truck. So, um, yeah, you have to go out there. And I went out there and it was so bad, the roads, that I ended up getting stuck at my job. Luckily, my mom lived across the street and my son was old. He was like a teenager then. And then my mom came over and then took the kids across the street to her apartment. But meanwhile, I got stuck at my job for 2.5 days. Once I got there was no leaving. So by the time we were done, we had like 2 feet of snow. I wasn't getting out with the car. They couldn't plow me out. I couldn't get out no matter what. I wanted to go home. I had my phone and that's all I had. I worked 20 hours, fell asleep for 4 hours, and then we all broke up shifts to fill it. But at that time, I was like, man, I hope my mom has enough this. So my older son would trudge across the street to my house, to my apartment, and get any of the little supplies they need and then walk back over. But I say that because there are certain things that at that time we didn't have. And then also we had a derecho in New Jersey, which knocked out power for like 2 weeks. With that being said, there was people that didn't have candles. They had no alternate ways to cook. There's people that have gas. We lived in the apartment, so they had gas, but they had no idea how to cook anything without the microwave. They couldn't defrost anything. They had no freezer. They didn't know how to cook. So you're having a barbecue outside to help everybody. And they just didn't have the basic concept. They didn't have a lighter. They didn't have candles. They didn't have matches. Like you'd be amazed at all the common things that people don't have when an emergency strikes. So I'm saying that I think everybody needs to think about this coronavirus and take it as whether it's 100% severe, and we all know it's underreported. There's over 10,000 now. CNN, they were talking about the estimated could be from this people in Hong Kong, 75,000 cases, which is crazy. That is a lot of people. So I think that we all need to think in advance about what we need to do for some kind of emergency preparedness to make sure that we're okay, our family's okay, our neighbors okay, and how do we preemptively not have these issues moving forward. We can wash our hands. We can have hand sanitizer. We can look out for our kids and look out for our neighbors and make sure we have bottled water. But we need to think about these things not just at the time of the coronavirus where everybody's like, I'm ordering masks. What about prior to that? We've become a society that is not proactive. We're reactive. And that's where the problem is. So with the coronavirus, we already know there's way too many cases. It's very contagious. People are asymptomatic, and I think the cases are going to be in the United States. They're going to get exponentially worse because we're still importing the disease. There are places that aren't importing the disease. God bless them, because that's where it's going to get better when you're not importing the disease. They're the little fake travel ban or whatever it's supposed to be called. I don't think so. I can tell you there's a lot of like nurses talking about, what we're doing, what we're talking to each other about things that we've seen, things that we've heard from different facilities. And that would make sense, Kenetra, to stop all the flights from China. But if you're anywhere near the Atlanta airport, sis, make sure you got some masks, because they're just going to just let people come in from China in Atlanta. These are highly popular. I still can't get over the highly populated cities. Why are they going to do this? Yeah, why would you, this is where I'm stuck. You have LAX, like Los Angeles, New York, Atlanta, like what else? Seattle, Honolulu, not as much. They just threw that one in there because I guess it's near Japan. San Francisco and Chicago. Where else do people fly out of? I was waiting for them to add like Dallas, Fort Worth. And they're just bringing, well, we're going to scan everybody. And all the planes from China are going to go to these 7 airports. All the planes are coming from China are going to these 7 airports. So anybody that has a potential infection without symptoms is going to these 7 airports. I think I want to move to Tennessee right now. All of it. It's February 2nd. All flights from China will be diverted to those 7 airports. Exactly. It's crazy. So what they'll do is, if you're just from anywhere in China, despite cases are spreading rapidly all over China, if you're like regular China, you'll have to isolate yourself for 14 days. Again, you're going to isolate yourself. You're going to stay home. You're not going anywhere. No one's coming to your house. Everybody in your house, including your teenagers and your kids are in school, have to stay home. Your teenagers are going to be sneaking out the damn door. I'm just saying. So all nobody can come to your house. Nobody can visit unless they're suited up, and maybe it might be a scientist. So all these 7 places are getting all the imports from China, these 7 airports, because I guess they can handle the capacity. I just think that you're setting up a big problem, because these people are asymptomatic. So they're asymptomatic and they come from China. So they're going to quarantine themselves for 14 days. But who's watching them? I'm not watching them. Local health department. So you have 100 people that you have to babysit that are coming from China. Yeah, how are you going to watch 100 people? And say these health departments, like the health department out here, there's probably like 6 people in the whole department. What? How are you going to watch that? You can't watch them. And then, like, what else? Then if they're from the specific province of Wuhan where the disease is wildfire, they're still taking flights from there. Yes, American citizens, if you're stuck there, they're taking flights from there. 100% still taking flights from Wuhan. Now, if you're an American citizen, I gotcha, you're still going to be quarantined. Then they're saying the Customs and Border Protection, because I wrote notes on this, I was not playing, from Wuhan province gets immediately isolated and monitored by the health departments if they were in Wuhan for the previous 14 days. Hi, Cody. Hi, love. So if they were in Wuhan for 14 days, they just get isolated. 14 days is not long enough. This thing's been around since December. What if they don't have symptoms, or, they're not symptomatic? And you're going to take them over and they're going to be like, oh, you just hang out with your friends in the room. Like, what? No. Because that's what they're going to do. They're going to be like, I need a pizza. They're going to get a delivery driver to come to the house. They're going to give them money. That's going to be isolation. Oh, I'm isolated, but they're not going to fact that they just touched the delivery driver who's now going to go and deliver everybody's pizza and contaminate everybody. Like, they don't think ahead. They don't think ahead. And then they're still saying that the risk is low. Well, if the risk is low, why are you quarantining these 7 airports? Why are you doing all of this? And the flights diverted, and then they have to isolate each other. You have to be isolated, and then all the flights from China are going to these 7 airports. So why, why all this? If you think the risk is low, because it's not low. I think the disease is underreported. I think the death toll is underreported. I think along with the death toll, I think the numbers are underreported. And if I live near any of these 7 airports, I ain't going near any of them. I'm gonna wear a mask. I gotta go up to North Jersey, and let me tell you, I'm gonna act like I don't care if I have to put nose plugs in, like from a swimmer. I'm not touching anything. I don't even want to go for training. Well, good, because the stock market should be crashing up because of it, because people should be more concerned about people's overall public health than money. And that's the problem. That's why we have all these diseases and people can't get healthy now. It's because you have people that are sick. Sorry, I'm sliding. You have people that are sick and they can't get the proper health care. They can't get it because it's so expensive. So expensive. Healthcare is expensive. You might have the best healthcare in the country, but half the people that live here can't afford it. They can't afford appropriate care, or they have to be on some public kind of Medicaid, or people that are on Medicare. Even Medicare people get bills. Like, it's crazy. This is the virus version of Mr. Robot. You're talking about like the iRobot thing, I think it's called. So I just think if you live anywhere near these airports, I think you need to be concerned, especially, their practices. Like the risk is low, but we're just going to bring them. I don't understand it. To me, it's counterintuitive to bring people into the country. And then he said, Homeland Security said it would be American citizens. Yeah, exactly. I Am Legend. I thought of that. When I seen all this, I was like, it reminds me of that Will Smith movie. Where's my dog? Sorry, I got my coffee. No, Geminis, you're fine. I just think that there's a lot of misinformation out here. I think they're not being truthful with the numbers. I think hospital systems and nurses and doctors are on top of it more than I think the CDC and everybody else is, because they're coming up with this stuff. Why don't you put some actual nurses and doctors that are actually in the field doing this? And I bet you this disease will stop the spread, because the way you stop the spread of this disease is you stop the travel of it. You limit the travel. Stop people from going from place to place. Regardless of how much it costs you, stop it all. You want to bring your citizens home? Russia's trying to figure out how to get their citizens home. People that are from Kenya are stuck in their students. What about the FDA approving imports from China? Well, they actually have another scary thing is that you're talking about people that are on cruise ships. I know there was that people that got stuck on the cruise ship, and then they said it wasn't the virus, but luckily the mayor was like, you ain't docking here, sir, until they figured out what it was. But you have cruise ships that are going all over the world now, and they're just picking up whatever. It's the same idea. They're boats with thousands of people, not like a plane with hundreds of people. These have thousands of people. Well, Bird, if we made stuff, we wouldn't have to import so much. I believe in fair trade, but I think if you made more things, you wouldn't have to import so much. I think you should always have items besides potatoes and for things farmers grow. Like, we don't make anything else right now in America, which is crazy. Like, we don't make anything. And I think that's why parts of our economy are struggling, because we don't make anything. And I think we need to make stuff. And that's the thing I feel. But honestly, by sea, by land, like, there's people that were sneaking out of the Wuhan province if they had money. So, and this was before after the quarantine happened. They were still getting on flights. They were still running around. Yeah, that's the problem. Hi, Sir Red. That's part of the problem. It's more financial. I think, ask a nurse what to do in this situation. Every plane is getting shut down. The minute you land here, you're already, look, nurses will tell you how to do it. You come from China, say you have American citizens, you're living here. Would I keep my American citizens in China if they're not already showing symptoms? Nope. Hey, listen, you get you, your Bob, your uncle, your Tom, get everybody together. You get on this plane and you're getting out. Boom. You're landing in this airport on this day. You will be isolated. Hi, Jess. I'm talking about the coronavirus. And you'll be isolated on this day. You'll be here for 14 days, 21 days, whatever it is, until you, whether you display symptoms or don't display symptoms. And this is what it's going to be. And I think, and then boom, spread over. There's no more spread, nothing up here, none. Like, I really think that should have been the approach right away. Hi, Jess, my favorite makeup girl. Jess is such adorable. She does the wonderful editing. But I was just talking about how she's probably doing like hours of editing. Anyway, I was talking about how the CDC came out with these new guidelines where they said that as of February 2nd, JFK, Chicago, O'Hare, San Francisco, Seattle, Atlanta, Honolulu, and LAX are going to be the receiving ground for all the rest of the Chinese imports. Imagine that. These are huge airports. So I'm a little unnerved about that because they're all major city hubs and there's plenty of people that are asymptomatic. So it's kind of scary being a nurse when you have all this stuff and then you're hearing that they're putting these things in. It's really not, to me, it's not safe. And you're bringing a population that has no symptoms. And they said if you're from the province of Wuhan, you have to be self-isolated. And then wow, that's crazy. It is scary. And I think, unfortunately, I think it's going to get worse. And like I was saying earlier, like the Chinese government said, oh, it's going to burn itself out in 7 to 10 days. It's not burning nothing out, honey. It's I know, Kenesha. That's crazy. That's super crazy that they think it's not going to burn itself. It's not going to burn itself out. And I was reading, there was CNN talking about Hong Kong researchers think that there are 75,000 cases in China and not the 10,000 they report because they don't even have enough tests to test these people. And now they're saying, as Sarah said, all the viruses we get told about every year, swine flu, Ebola, corona, and all that is a decoy for the proper disease the powers will put out on us, will wipe us out for the depop. This is what I can tell you. There's a lot of diseases that could have wiped out a lot of people. And I'm not a fearmonger. I'm not interesting. Ebola was crazy. People were like throwing up blood. It was just, it was bad. Ebola was bad. Ebola was bad. It was super contagious. It was so bad. But I think the problem here is that you have these recommendations that they're putting in, and they're just taking these people that are asymptomatic, and then we're going to scan you with a thermoscan, and they're taking all the Chinese imports. So we're going to scan you with a thermoscan, a temperature. If you don't have a temperature, you go home, and as long as you're okay, we're going to get the local health department to keep an eye on you. How big is a local health department? 5, 6, 10 people. That's how big it is. Maybe, depending on what size your town is. So imagine you have 50 people in your town have to be watched by 5 people. You cannot watch them. What are you then going to do? You're going to put them in hospitals and then take infected people with already sick people and then make it worse? Or you have no idea. So I think this is foolish. I think you should have, at least if you wanted to do this idea, you should have done it 3 weeks ago. If you wanted to quarantine people, or like I was saying earlier, get small airports that can accommodate the planes, and then you put them in. Listen, okay, well, we have 200 people here, and okay, there's the Best Western. We're going to pay that bill. And guess what? We're going to monitor all these people have to stay in this hotel, quarantined, or this place for 21 days. Not 14 days. You don't know the whole duration. 21 days, 3 weeks. Yeah, stay there for 3 weeks. And what happens? You're not symptomatic. And keep them isolated. listen, we'll come bring you food and suits, whatever they got to do, because I think that's what needs to happen. And right now, this is scary even as a nurse, because I'm looking at this like this is just like so backwards. It's asinine. Like you're doing the steps to prevent it, but you're saying the risk is low, but then you're squeezing everybody in one airport. Like it doesn't seem like being a medical person, like being a nurse, like the numbers don't add up. Like 2 plus 2 always should equal 4, not 6, or in this case 7. It shouldn't be that way. And they're saying that they find things and then, oh, we don't know, but we know, but we don't know. And so they're, even though they're saying there's a lot of confusion in the media, they're a part of it. They're part of, like, I don't know whether, well, we think it's asymptomatic, but we don't know. But we've had a lot of cases, so we're just gonna guess, and then we're gonna put the information out in the public. Like, well, who does that? Your answer: be honest with people and say, you know what? We don't know. We don't know. We don't know, and we don't know some more. Oh, your baby boy is sick. That shocks. Yes, Ebola still exists. 100%. These viruses don't just go away. Like, you can look on the CDC website, and there's still cases of MERS, but there's 2 and not 500. There's still cases of Ebola, but there's 2 and not 500. So there's cases of stuff. What's scary about this is because it's all new. Yeah, it feels that way. But these are all new viruses. If this was a bacteria, I'm certain the scientists would have got that done down, already nicked it. It'd already be over, because there's so many bacteria, like antibiotics right now. But even bacteria, there's some resistant germs. They're called MDROs. So they're getting to the point where people are inappropriately using antibiotics. And so now you're starting to have bacteria that is resistant to some of the strongest antibiotics, hence the word MRSA. Everybody knows MRSA, MRSA, methicillin resistant Staphylococcus aureus. Staph was like a bacteria. You took some penicillin, it was over. Now, methicillin being one of the strongest antibiotics doesn't kill it. And it's like rampant everywhere. You got to isolate people, and they have it. They just keep it. It's crazy. It's colonized in their body. So I really think that people are, any of these, I think is anybody in the remote area of these airports, I think they need to be mindful. I think that, and not to be like, a scare person, because that's just not who I am. I think as a nurse, I should be more aware and alert of what's going on as a community out there. I think you guys should be more, mindful about making sure that you have some things just in case something goes awry. Like, okay, these masks aren't perfect, but just in case I might need them. They even have little kid N95s. They're like that big. I've seen them. So I think people need to be mindful. I know Mom Life and Jess have sick kids. That sucks. That sucks. Guess what? I have all boys, and when they become men, they're just as bad. Oh my God, they're babies when they get sick. They are. When men get sick, it's worse than little kids. Little kids, like, cry and they whine, and then they kind of, they'll be okay for a little while. Men, they just cry and they whine, and then they cry and whine some more. House full of men. I think you should get some masks. And I think, like, I have that part in my video showing how to put them on. Like, I think it's a 22-minute video. It's at like the 10-minute mark. Because what prompted that video and then all of this is because I seen some girl on, yes, you can get eye protection, you can get face shields, but most people are going to cough and sneeze, and they're going to have droplets. So the best thing to do is wash your hands and wear a mask, because those germs are going to go into your nasal pass. The cells fit like a lock and key. The coronavirus has the key to the lock in your lungs and your respiratory tract. So it's able to actually fit and attach to those molecules. So yes, they're wearing eye covers and eye shields and all them, but the most likely that they're going to have that adherence where that lock and key is going to fit is definitely through your respiratory tract. Hence why people are getting stuff that looks like pneumonia, runny nose, all of that. That's what happens. They're getting symptoms and they're progressively getting worse fast. I'm not taking no vaccine that they bring out in 3 months. Sorry, I don't think so. Nope. And I don't trust it, because if you can't come up with a vaccine to the common cold, you're not giving me nothing for no coronavirus. Because they're both most of the colds are coronaviruses too. No, thank you. And they all mutate, so they should come out with a generic vaccine for the coronavirus itself. So your body can make antibodies to a coronavirus in general. Not, yeah, no. No, yeah, don't. If they have a generic vaccine to the coronavirus, I would take it, because my body will automatically build immunity to parts of the coronavirus, like a passive immunity, meaning that I don't actively have the disease. I'm not taking nothing that's developed in 3 months. I don't want the SARS vaccine that was developed in 3 months. I need a lot of research, and I'm not going to be your guinea pig because I work in the medical profession. Like right now, nurses and doctors in a lot of buildings, we have to get the flu shot, regardless of the side effects. We have to get the flu shot. But there's people that come into the building who don't have the flu shot and infect the patients. So they just make us get the flu shot so we can keep coming to work. That's what everybody says. Because technically, we wash our hands more than most people in the community. So guess who brings the flu? Your mom, your uncle, your dad, your cousin, your sister. That's what happens. That's who brings it. What happens? An immune boosting herb, it ain't gonna help this. I don't care what kind of, you can boost your immune system, that's fine, but if it's never seen a disease before, it's not gonna be able to fight it. That's why a vaccine works. Yeah, ain't nobody got time for that. Look, 100%, I definitely don't got time for that. I have no time for I don't like taking the flu vaccine. I'm forced to take it through my employer, or I gotta wear a mask all year long, and it makes it hard for you to breathe. Like one of them yellow masks, no matter what you do, so you're changing the mask, you're going back. And then I don't feel like a family member should ask you, why do you have a mask on? And then you have to tell them your medical history. Like, I didn't have a flu shot. I think that's inappropriate. That's violation of my HIPAA. Honestly, that's how I feel. It's just me. I shouldn't have to share my private health information with a family member who doesn't wear a mask. You always forget the second dose of the kids. I think any kind of immunity that you can develop will help, honestly. And when your kids, because I was a nurse, I think my kids have a stronger immune system, because I have an immune system, a really good one. And then being around me, anytime I got a cold, if they would get a cold, sorry, I get up really. If they would get a cold, like if I got a cold, they would get the cold, but they're getting the weakened version, because by the time I gave it to them, it was half dead. And so over the years, even like stomach viruses and all this stuff, I think my kids have got sick, all four of them together in the last 5 years. I probably can count maybe 4 or 5 times in total that my kids have got sick. My one son, he hasn't been sick since he was like 12, and he's 20. They don't get sick. They eat right, they eat well, they drink water, and their mom's a nurse. So all the germs that you come home with, when you get a cold, they get a cold, and that's just how it is. So they have a hellified immune system, which is good. But I'm going to be doing definitely more days of coronavirus, because it's really scary as a nurse, and it's also scary when you're anywhere near these cities. I know people are talking about they don't want their city, especially these main cities. They're having an issue with it. Even New York is having an issue with, like, what? Not here. Oh, yeah. Yeah. You works at the airport at a rental car place. Yeah, that's the problem. Yeah, you can get the flu because it's a different strain of the flu. That's what happens. So I'm going to be, sorry, I was tired. Sorry, bird. I'm going to be looking around. Like, I got home from work. I had a long day. Nurse life, seriously. I usually get up at 4:30, 5 o'clock in the morning. My days end like 5:30. And by the time I get home, it's like 6-ish. So, and I had to watch that video from the CDC twice because I couldn't believe my ears nor my eyes. So, and I had to take some notes, but I'm going to be updating and watching the coronavirus craziness. Um, I definitely think if you can find masks, get masks. Pure Mind Life, if you have little kids, they have little kid masks. I think you should look for them. And even now, if you don't get them now, and hopefully nobody that I ever talk to gets it, I think moving forward in the future, you need to be a little more prepared and have like you can have one little box, like one little Tupperware, not Tupperware, like you know, one of them little bins, like a little totes, and have one. He might be living by himself, but for a bit, yeah, I bet he might be. Um, yeah, yeah, you could get masks up the wazoo, but understand like masks are not an eternal thing. They do have like an expiration date on it, means to where the filter, which is the color side on the mask, isn't as effective because it just degrades over time. Oh, Jaminies, it's okay, love. You know I love you. You gotta go live later. I want to see you in Kanisha. Um, you can have heavy duty vapor masks, but you still need a filter. N95s, you have to take them off. You still have to throw them away. So if you're gonna get any kind of mask, you should be thinking, okay, so if this happens a couple years from now, what are my steps? Hang out. Well, the crazy thing is it's affecting a lot of people. It's not just affecting Chinese. It's just not affecting. It's very sad. I know. I love you, Geminis. Don't worry about my sister from another mister because she's in Japan. But I think it is concerning. I think you need to be careful. I think you should have like some certain supplies that you should be able to go to, being like, all right, I'm cool. And the best thing you could do is make yourself a list. Make yourself a list of, all right. And you always can catch me in the comments if someone told me, because I'm actually a crafter, wreath maker, nurse, and usually I don't do the coronavirus crazy. Yeah, I bet the price has skyrocketed for replacements. Someone told me I should do like a separate channel because I'm. Oh, she said, Bird, stop using the numbers because sometimes it'll spam the chat, Bird. But it's okay. Sometimes it will, sometimes it won't. So because sometimes it'll spam, it'll end up spam the chat. It'll end up like going in the spam while the chat is coming by. But it's all right, baby. But I think definitely you should prepare for the future and figure out what you do and what you got to do and moving forward and be no baby, it's okay, it's fine. I think you should 100% be mindful of your surroundings and please 100% please do not discriminate against Chinese people or Indian people or any people or any of the countries of the people that are affected, because I'm certain if we as Americans had a virus that initiated here, we would not want to be in other places and have people treat us differently. You know what I mean? I think you should. I don't care. The Chinese people here. Who cares? You gotta love people all the same. So if you're gonna get the virus, you're gonna get the virus. They're gonna get the virus. We're all gonna have the virus. So I just think that you should love people all the same. Please don't discriminate against the Chinese people, especially American Chinese people that are in the country. I just think that they didn't start the virus. They didn't create the virus. So I think you should just treat them kindly. That's just what it is. Yeah, these people here are not wearing masks. In China, they will lock you up for not wearing a mask. 100%. 100% China is on like red alert. They will lock you up if you don't wear a mask. I don't know, Jam. There's too many cases that are close by to you. Like I would look, where you live in Japan. I would look at like the map and see if any of these people are close to you, because these people have no symptoms. And that's the part that scares me. You have no symptoms and you're out here and I've seen the bus ride. You out there coughing and sneezing and touching the rail and oh, girl, I wouldn't make it over there. What do you mean if this is real? It's not the people, it's the government. Of course, it's the government. It's definitely like the government underreported in SARS, and so everybody is very apprehensive about what's going on with the Chinese underreporting. So, are they underreporting? Are they the amount of deaths? to make it look like it's not so severe, so they don't panic their citizens. Because you got 60 million people under quarantine. It don't take much. You got 60 million people to push through one of them little barricades. They're out. It'll really spread. So, is the virus real? If the virus is real, how are you still alive? Honestly, think about what you just said. Of course, the virus is real. I don't know what the time that they'll put you away for, but I have heard that they are locking people up, 100% locking people up for not wearing a mask because they're trying to definitely inhibit the spread of the virus. And that's the important part. Yeah. That's great that air pollution kills all those people. But the problem is we're talking about a coronavirus. So, see ya. Oh no. Yeah, you have to understand that, it is. It is like what you're saying. I get it, Bird Beak. But I just want everybody to be clear, like when all this happens going forward, you have to understand, like, please make sure that let's not go crisis to crisis. Let's go from being a reactive society where all of a sudden everybody's buying masks and nobody can find them on Amazon because China makes them and they need like 200 million. And then you need them in the medical facilities in the United States. So, of course, hospitals and nursing homes and places of business are going to get them before the general public. Sorry, it's just what it is. So I just want to make sure that everybody is aware, make sure that I'm going to try to keep on top. Yes. I was just going to, girl, you already know. I'm a mod everywhere, even in my own space. But honestly, I think people need to be aware. I think people need to be mindful. And I think we need to stop being, hi, Jay. Thank you, Jay. 100%. It doesn't cough in your face. And then your lungs are filling up with fluid and you can't breathe and need a ventilator. You're welcome, Shannon. I just think people should just be mindful. I think I'm a crafter. I'm a nurse, an RN, and I seen how this all started with me making a few little videos on this subject. It's because people were scared. They were asking me a lot of questions. And then I dropped it. Then I seen someone on Instagram. Let's see if you can see. That is the lighter side. And as you can see, this is the darker side. And what happened was I seen somebody on Instagram, and it burned me to my nurse core, wearing one of these backwards. Like, I would never, like I've said it before, I never wear my hair down. They had it like this, essentially. Like you can see right here, all this gap here. Like, they didn't even have it on right. And they had it on backwards. I was so floored at seeing that because it was just that bad. I was offended to my nurse core is what I said. I know Aunt Maddie got monetized. Girl, she sent me an email message. Yes. 100% Aunt Maddie got monetized. She sent me an Instagram message because I was just going off. Let me tell you, that lady's playlist, whew, Jesus. It's on the track team. But I'm going to go through it again for my girl Jamanese. I have one of these yellow masks. And I'm going to put my hair up because I got a lot of hair, as you could tell. A lot. This is my first bunning. This is before I put any mask on or any gown. Like, I got a big bun. I got a Cindy Lou Who bun. So, first, when I put this mask on, make sure it's the right side. That's the dark yellow side. Right? See that? You see how it's flush against here? It's flush. All here. Here. Look, there's no gap here. And I have it flush. There's a lot of years of putting this mask on. Press down so it's all against your nose. It's all flush here. There's not a gap here. and there's not a gap here. What happens is right here, there's a gap. But because the way this mask is, let me show you. Like it has them little side ripples. There's no real way to stick it to your face. Only these little, right here does it. So, and I definitely wouldn't take it off. And what started it is because I seen somebody take it off like they was taking it off. What? Don't you ever take it off like that. Because make sure it's flat up top. There's no gaps where your eyes are. You always have these little corner things, but they're pretty close. And then you have your chin, which is good. But when you take a mask off, you got to take it off. Take it off. Like, don't take it off. Like, don't take it off from here because I know you see it on the TV. Like, if you take it off this way, you just contaminate your whole hand. So you got to act like this whole thing is no good when you take it off. Like, I used to be able to, like, I was like the mask guru. I could flip them on and off with ease. But that's how you got to take them on and off. So, Jamie, I had to show you. Look at all this mess. So, that's what I'm telling you for today. Oh, Lord, my old nursey self. That's what I'm trying to tell you. That's my message for today. There's a lot of people. They're flying all these people into these American airports. I think the numbers are going to go up in America because they're going to receive all these people. They're going to have to quarantine them. And I also think that the numbers in China are going to go sky high. Sorry, they are. I think that there's a lot of cases there and they're not leading on because they don't want us to realize how maybe deadly this disease is because you have 75,000 cases and 10,000 deaths. I think that's a lot. I think when they start going home to home and checking on these people, it's going to be a problem. There's a lot of elderly people in China and they don't always live with their family. If nobody's checking on them, they could be deceased. It's so sad to say. And I hate saying it, but it's the problem. So, no, definitely not what I hear on the news. I already know that. I'd be a fool to listen when they said there was 500 cases. I was like, you need to multiply that by like 5. All the millions of people in China. Like, are you kidding? It's just ridiculous. But I'm not sure about the death tolls either. I think those numbers are low and skewed. And I think they're trying to do a job, but I think that they're also worried about their economy. And like this quarter, they're going to lose like $1 billion, which is unheard of. But you got to do something about the wet markets, get that under control because people aren't going to want to visit. Like, China's going to be stung for a while with this. People are not going to want to visit. I'm not going. And if I was going to go, definitely not going to go now. I'm not going to any of these markets. I'd be afraid to eat, consume food, breathe, like all those things. So anyway, everyone on my live, it was nice talking to all of you. I'm going to continually try to look for stuff. And hi, Lulu. It's okay, honey. You're allowed to be late. I'm late all the time. Lulu, I was just saying, get my girl Lulu. Lulu's a sweetheart. Tuesday, I'm still going to do my regular lives, but I just wanted to do this because I've seen a lot of information and I was kind of awestruck by CDC and their garbage. They're going to be landing planes at 7 main airports and receiving all the Chinese people or Americans that are in China. Like, to me, they're going to contaminate everybody. So, my lovies, Lulu, I'm just about to get off. So I'm going to give you a brief synopsis about what I was talking about. I was talking about, hi, McTow. Yes, darling. Yes, definitely stay safe. Lulu, I was talking about how the CDC said that they're going to be flying in people from China with, it's funny how it comes about when all their population was riding. Yeah, exactly. Night, Jamie. I'll give Lulu the update. Are you going on later, Japanese? You or Kanisha? Yes, doll. Lulu, the brief synopsis is 7 airports in the United States have been determined by the CDC to be able to receive people from China, whether American citizens and their families, and naturalized citizens and unnaturalized citizens. And they're going to be, I've said it so many times, San Francisco, Atlanta, LAX, maybe Kenesha. Yeah, I'll catch her. Honolulu, Seattle, Chicago, and JFK. So 7 airports are going to be the main, of the largest airports, are going to be the main receivers of Americans and other people trying to get from China into the United States, which is just concerning to me as a nurse, because I just think bringing a population of people that are asymptomatic into one of the allergic airports is just asking for problems. And as a nurse, like, my ears, eyes, and antennas are going to have to be up, because I live not too far from those areas. Well, at least one of those areas. And I think if you live near the area, you should also be mindful. So, yes, my loves, ladies and gentlemen, I'm going to take it down. Been on for a while. I'm just going to still keep updating and keep trying to figure out the coronavirus and what's going on. And there's a lot of stuff going on. So I'll probably do another live, unless there's something emergent comes out, but I know they're going to be reporting cases. I might do on Sunday, to figure out the Super Bowl. Yes, I have to finish my wreath. I do. I haven't finished it yet. It's because I've been working so much. Anyway, guys, I love you guys. Stay 100% safe, and always remember, be proactive and not reactive. So with that being said, my loves, I'm about to eat out. I get to chill with my kids, my man. I call my men. And everybody stay safe, be well, and just be mindful. Proactive, not reactive. Remember that. It's the best way to be. All right, y'all. Good night.